One. We have about a minute to start this session, and before we start the session, we have got a question for you online. Please, you can use your phone, take that kind of code, scan it, it will take you to a question, and try to answer that question, and we see if we can have the same response by the end of this session as well. So the question is, can we achieve inclusive sanitation for all without shared sanitation? It's a very simple response. We want a yes or no. Do you think we can achieve inclusive sanitation for all without shared sanitation? This session, we'll run that question again to see if the responses are changing. But we wanted to start with that to know where we are. All right, now welcome to this session. This session is convened by a couple of people, groups, or some are research groups and some are government officials or authorities that will be here. So we're having the Ministry of Water and Environment from Uganda is part of the team organizing this session. We also have Habitat International is part of the team organizing this session. We've got the University of North Carolina, Chapel Hill, that is also organizing this session. We've got Kampala City Council Authority, part of the organizers of the session. We've also got Makerere University, part of the organizers of this session. We've got Water for People, also as the organization putting together this session. And lastly, we've got Sanergy, that are part of this session. So I know people are still coming in. As we said, we shall start with a question. And I want to share with you the responses before even we start this session. Oh, it's not working.
We have 16 no and 2 yes.
Oh, 16 no.
And 2 yes.
Oh, I'm surprised. Okay. Good to know that most people are already recognizing the importance of shared sanitation. I thought I was going to get a yes. But, all right, so let me start by this. My name is Dr. Musa Manga, and I'm from the University of North Carolina, Chapel Hill, and I'm an assistant professor in the Department of Environmental Engineering and Sciences and Engineering. My work is all about trying to improve access to all these people who are left behind, all these people who are actually marginalized. And I focus more on trying to see how do we break those barriers to make sure we give them access that is sustainable. And for that reason, I'll be the chair for this session. And basically, I'm starting by reminding you about the presentation that was made by Rick at the beginning of this event on Monday. which was more about the GMP and the progress they have done, which is really great. We never knew we'd get there. And I think we need to say thanks to the GMP team for doing that amazing job. And therefore, in that session, they talked about the Sustainable Development Goal 6.2, which is going to be the main focus for this session, which says by 2030, we may have to achieve access to adequate and equitable sanitation and hygiene for all, and end open defecation, paying special attention to the needs of women, girls, and those in a vulnerable situation. One thing that comes out clearly there is that talks about equitable sanitation and hygiene for all. The question is, what happened to these people who are living in these informal settlements? These people, if you talk about the basic sanitation and the sanitation ladder, requires you to have an individual toilet. But in such communities, that's very hard to really achieve. You can't have individual toilet because someone is struggling to have where to sleep. So if he's struggling to have where to sleep, he can't be thinking about the toilet. So what some authorities have done, and some people have invested in these communities, to give them a shared sanitation. But there's a lot of heated debate about shared sanitation that has been going on for long. And we think we should probably really not shy away from that heated debate. We need either to go in and look at it clearly, think about it, and think about how do we think about these people? How do we think about these people living in these communities? And for that reason, we have this session today where we're bringing evidence from Bangladesh. We're getting people from Kenya. We're getting people from Uganda. And we're all in here to talk about this kind of way they're providing access to these people in these communities. On top of that, we're getting evidence from the UNC team who have taken a big lot of study to look at all evidence published globally on shared sanitation. And they actually got a lot of studies in there, and they narrowed down to around 178. So they'll be sharing with us what did they find, and what should we be doing, or what should we do to make sure these people have got access to sustainable sanitation. But as the chair, I'm not supposed to spend much of my time talking. I'm supposed to have these people talk to us who are really working in these communities. So I'm going to take this time to welcome the people we are going to have in today's presentation. We shall have the Assistant Commissioner from the Ministry of Water and Environment, Uganda, who is basically talking about urban sanitation. That's what he does. He's basically looking at how do we give access to these people. And he will give you a high-level evidence of what exactly is he doing to try to make sure these people are having access to sustainable sanitation and challenges they're facing, and what should we do to make sure these people have access. So we'll have him to give that session, and then we'll have John, who would be coming from the Director of International Shelter Initiative from Habitat for Humanitarian International, who would also be talking about evidence from Bangladesh. What have they been doing to make sure they give access to sustainable sanitation in these communities? And then we'll have Dr. Swaib Semiaga, who will be presenting on behalf of KCCA, Water for People, and Makerere University. And he's been working in informal settlements in Kampala, and he'll be telling us what they've been doing there. And then we shall have Ruth Osmag, who is actually the Director of Citywide, Citywide Advisory Services, Sanergy International, who would be talking about evidence from Kenya. What have they been doing in Kenya in trying to provide access to sanitation? Lastly, we shall have Sir Lebu from the University of North Carolina to tell us global experience and evidence that are put together about this issue. And what should we be doing if we really need to make sure people are having access to basic sanitation? And once we finish with those presentations, it will be 7 minutes. Then we are going to have an open floor. We're going to spend much of our time. We want to hear from you. We want them to give us what they actually been working on and what they've been doing. But we want to hear from you, what can we do to make sure these people are not left behind? And we'll have that session going on until the end. But at the end of the session, we're proposing to have a working group, which is going to be called ASSIST. And this is advocacy for shared sanitation services in informal settlements. All people want to join that. You'll be seeing that at the end of the session. Try to put your name up there, and then we'll see how we can think about these people if really we're going to achieve sustainable sanitation. So I'll take this opportunity to welcome the Commissioner from Ministry of Water to tell us high level of how they are trying to address these issues.
Highlighter. Yep. Where's the presentation? Okay. Okay. Good afternoon, ladies and gentlemen. The name has already been introduced, Engineer Felix Twinomchunguzi. I'll give my brief, remarks and a situation on how we are faring in Uganda overall on the issue of sanitation, safely managed, access to safely managed sanitation. Ladies and gentlemen, as has already been stated by the goals, our aspiration is that everybody in every part of the country, every part of the world, should have access to safely managed sanitation. Unfortunately, for our country where we come from, Uganda, we see that we are still averaging around 40%, 41, 42% in the urban areas, a little bit off in the rural areas. And this situation is not unique to Uganda. You can see it's the same comparable to, just like in the eastern region of Africa, compared to Zambia, Tanzania. It's all the same, which is almost half of what the global average is to access to safely managed sanitation. Now, this challenge, of course, this. Help, please. Yeah. Nope. Okay. Yep. Yes, and the effect of this is precisely that. We are glad we have a chair of a Uganda National Planning Authority, someone responsible for channeling the whole entire country. But madam, you can see that this issue of poor sanitation is costing us, as per 10 years ago, it's costing over 1.2 to 1.5% of the national GDP. That was the estimates done, the studies done by the World Bank. I show that the effect of poor sanitation is that, as in monetary terms. Take it into other aspects of loss of life. The World Bank estimated that we are losing almost about 20,000 people annually in Uganda every year because of the problem of poor sanitation. And of course, there are the issues of contamination. We have had a lot of this debate and discussion about this. Now, for a small country like Uganda, we are about 45 million inhabitants to date estimated. About a quarter of these are living in urban areas. And these same areas are areas of highest urbanization rates, rate of about 5% per annum increasing. So it means that this urban population is growing every year. And as it's growing, look, we have almost 60% of all people who are coming are all living in these so-called informal settlements. So you have 60% of all those people living in these areas called informal settlements. And if you look at the statistics there, yes, only about 45% of the people in urban areas use sanitation facilities that are not shared. The rest of, close to 90%, everybody uses shared sanitation facilities. So whether the question is whether we recognize them, whether we don't, the facts are there that over 90% everybody is using them. Now these statistics are worrying in themselves, but what worries me most is this little graph I've showed here. We've taken some statistics of Uganda over the last 5 years of what's happening, and considering that we are having 8 years to achieving to the Sustainable Development Goals, you can see the way those curves are really flat. We are really going nowhere. There's no magic that's going to get us to jump from this 40% to reach 100% over the next 8 years. So we have to think different ways, different aspects. We have to think out of the box. We have to think, how do we resuscitate this situation where we're having really limited progress that we're achieving. I said, if we don't do anything, actually doing nothing, then we continue with this same situation. We continue with the loss of GDP we've talked about. We continue with the loss of life in these areas, and therefore it's no development. So we must look outside the box. We must think of different alternatives and all these possibilities. And these effects, of course, are shared here in what we call our sheet flow diagrams, trying to, this is just a typical case of any urban center within Kampala, clearly showing that, well, over 90% of people are using on-site sanitation facilities, and over 80% of this is ending up into the environment untreated. So we need to think, and our thinking is that shared sanitation is probably one of the ways that we need to give a little bit more attention to, try to make it better and see how it can contribute to improving this access. Of course, we know there are many questions, there are many pros and cons, so many things as we're going to be discussing through the course of this session, which have been raised in different fora, but there is some optimism. There are challenges. How do we manage operation and maintenance of these facilities? A big challenge. Yes, we appreciate the land tenure, but if you look at now the land tenure, look at the picture there on the right. That's the situation there, which also Dr. Musa had showed. How do you put a single toilet on each of those roofs and households? It's quite difficult, very difficult. These are guys who are living there. They don't even own the land. The land tenure negotiations are difficult. They're not in charge of the land, so it's very difficult. The only option you have is have a facility that is shared, which is slightly outside and can be easily accessible and emptied. We have challenges. The security, how people can go at night to reach this facility. A girl child in the night trying to reach this facility. It's a challenge, we acknowledge. These are difficulties, but we need to find solutions to these difficulties rather than saying that we are completely, we don't consider them. And the people living in these areas, they are really low-income residents, so trying to build a new toilet at a cost of about $1,000 US normally takes them a long time, and they are not willing to put. How to institutional support in these individual areas compared to usual ones. We also know there are some social cultural challenges. Of course, your people in these areas are mixed ethnicity with different practices. How you get them to share the same facility, they will have tensions and fights among them. We know and we acknowledge that those challenges are there. But probably our suggestion there could be some designs that can be made and try not to make the situation much better. This debate certainly is all about sanitation facilities. But we know also, if you look at our system in the entire WASH on the water supply, over 30% in people in these urban areas actually use these shared water facilities themselves, which are not considered already on the GMP discussion of what a safely managed water supply is, but it is a reality in the areas, and the communities are being supported in one way or another to manage and do very well with these water facilities. So we believe that even in sanitation, such groups which have come up in these communities can be supported, and we make shared sanitation better, and we think this could contribute significantly to improving the statistics on improved sanitation in urban areas for the vulnerable communities. Thank you very much. That's my discussion.
Thank you so much, the Commissioner from the Ministry of Water, Uganda. Could we have someone who really works in these communities to tell us more, what are they doing, like KCCA, Kampala, and Water for People, and Makerere University, to tell us more about these informal settlements?
Thank you very much. Good afternoon, everyone. Swaib Semiaga. I'm a lecturer at Makerere University, that is Kampala in Uganda. Okay, I'm here to say something about the status of sanitation in these informal settlements of Kampala, and also I'm going to say something on side of KCCA in the 7 minutes I have, and also Water for People. So unfortunately, they did not come, but also something about what they are doing, okay? Yeah, if you look at the informal settlements, we have had research that has been done in the informal settlements of Kampala. And this research, I think one of the most prominent one is that of 2012, where we had over 50 slums, okay, collecting data on over 50 slums. And if you look at like a sample of some of the slums we have in Kampala, I think some of you who have been in Kampala can attest to some of these photos. And also looking at the population in Kampala, that's over 4.8 million people by 2021. And the resident population is about, that's about 1.7 million. The rest are coming in for work. 60% are in informal settlements, as the commissioner has said, also for the other parts of the country, but I will talk mainly for Kampala. But in such kind of households, as the commissioner has said, this really becomes very, very challenging to have a facility for each of those households. Let us look at some of the statistics that came up in the study that was done between Makerere and EAWAG in 2012. You find that in this study, about 95% of the urban poor in over those 50 slums had access to on-site sanitation facility, on-site either pit latrine or the septic tank. But the 95% who had access, this was all inclusive of public toilets and even shared toilets. So, of course, for GMP, we may have no access, but for if we consider the shared and public, over 95% had access. That's the dilemma. And if you look at the over 95% who had access, 70% were tenants living in one room, each room of about average 4 people, and these are using a shared or a public toilet. And the question here is, would it be more won't it be more costly for households, for each of these households to have its own sanitation facility? Actually, the answer is definitely yes. So you can see the form of sharing we have in Kampala. So among the shared and public toilet users, one stance is on average shared by 30 individuals. That's about seven households. These are realities of what's happening in Kampala. And also the private toilets are like just a privilege to house owners. If you look at also the graph, I think, if you look at the graph where we have the private whatever, this is just very, very, very minimal when it comes to tenants. And it's the owners that have about 30, close to 39. So it's just a privilege to house owners, but tenants, it's really very minimal. And the tenants are the ones which you have that are constituting more 70% of the 60%. So now how can they have access to, or how can they afford sanitation? And also you'll be able to see that, of course, the cost of an improved sanitation facility here exceeds even the annual income of these people. So how can they have access to facility where they cannot even afford the facility as a household? It really beats also our understanding. Also, when it comes to 45% of sanitation facilities, many of them are abandoned, of course, when they are full, and this also goes back to the quality of facilities they have. And of course, things which you need to look into could be things like improving quality and many others. We have done work on how the emptying is happening in slums given the kind of facilities that we have. And of course, if you look at the emptying also in these facilities, you could see that a number of them, because of access, it is mainly the tricycles which can play a very important role in accessing, and just a small percentage of trucks can be able to access those facilities for emptying. Now, after that, I need to talk about some things about KCCA is doing. Of course, under Citywide inclusive sanitation, they are looking at a regulatory framework in order to see that everyone is considered, whether in informal settlements or in non-informal settlements. And they have come up with quite a number of documents, legal documents, like minimum standards, like how can a sanitation facility, improve the sanitation facility be, the ordinances, the sanitation improvement strategy. But all of this is not focusing at only those people that are having or individual households. They are looking at all people in Kampala, including the slum area. So any kind of improvements to be done could be able to follow all of these, to follow these documents. And this also brings us to what Water for People has been doing. Water for People as an NGO is one of those that are providing access to improved sanitation to slums. And in one of the work that they have done where they are targeting about 200 households, they were able to increase the improved access to sanitation from 35 to 60%, but not where they were working. And also another thing to note is that these are facilities also under informal settlements, meaning they are also shared. The bit about this is when we say that shared sanitation maybe is not acceptable, even with these posh facilities that have been provided, we are going to say that we have no access, yet actually there is something that is being done. So killing all the efforts of organizations that are trying to improve sanitation will be really a big discourage to a number of investors in this sector if we do not consider shared sanitation. I will not say anything more than that. This is just to show what has been done and these other different financing strategies that Water for People has done in order to improve access to improve sanitation in informal settlements. In case of questions later, my colleagues from Water for People and KCCA will be on the panel. Thank you very much.
I am really so grateful to see him say that at the end, because one of the things I was worried about is this real information from Water for the People, or is it from KCCA? And I'll probably confirm to you that we're going to have Yvonne Lugala, Water for People Online, in the next session, who will be talking to you more about this. We'll also be having Barbara Mary from KCCA, who will be speaking to you more about these issues. We've had a lot from Africa. Why don't we go to Bangladesh? Let's get someone to talk about Bangladesh. What is really happening there about access to sanitation in these communities?
Okay, where's my... Okay, good afternoon. So I'm from Bangladesh. A colleague was supposed to be here, but unfortunately he's not. So I'm stepping in, but I've also been part of the work that is done there. So this is actually coming from Habitat for Humanity International. Everybody would have heard of Habitat, probably through the name of Jimmy Carter, or if you haven't heard. We are a housing-focused organization present in 70 countries, and in the US, about 1,300 affiliate offices. And our main mission is to help bridge the housing gap that exists currently. And we know that by 2030, about 3 billion people will be needing adequate housing. And so that's a big gap that we are trying to help bridge. And then we also know that this discussion of informal settlement has already been started, and about 1 billion people currently live in informal settlements. So the question of can we have inclusive sanitation without shared sanitation, if most of you said no, then there's need for us to discuss more. And so I'm just going to touch on a couple of things that we do. I've already introduced Habitat, but Bangladesh is one of our 70 countries that I talked about. And if many of you have been to Bangladesh, or if some of you have been to Bangladesh, you would know that this is a low-lying country. It's not very high from sea level when you talk about altitude. So most of the area is flooded, and informal settlements are also everywhere that you go within Bangladesh. And out of that 169 million people, about 2 to 5 million people are living in informal settlements. So this is a huge gap that we are trying to help in terms of housing and sanitation. Unfortunately, we have to find ourselves with the issue of land. Land is a big issue in Bangladesh, and so to give everybody an individual sanitation is not possible. So what Habitat is doing is we enter the communities and we try to see how best we can cluster them and get them to enjoy some of the sanitation facilities. And so what you are seeing, the pictures that you are seeing there is what we go into the communities and partner with them to do. We construct community bathhouses with water reservoirs, make sure that they are able to flush if they use it, and then we contain, we're able to take all the waste contained in a septic tank and can be removed when necessary. And then we build the toilets, and we also, everybody knows that in informal settlement, walkways can be a huge problem. It can be source of malaria, or mosquitoes breeding areas. So we try to also address that as well. So as you can see, that is what we do. I have only 7 minutes, but here, the statistics that I have here, we have 67 community water collection points that we try to help address in the informal settlements, and over 90 community shared sanitation facilities that we also construct there. And we also construct several thousands feet of walkways just to help improve. And as you can see, the people, they are all standing on a walkway that has been covered. Now, if you had gone there before this whole construction, you would realize that nobody can stand there because there's a lot of mosquitoes and all those coming in. So we try to address that as well. So as you move forward, you can see that all our facilities are well constructed. We try to make sure that we implement all the community trainings that would help keep these facilities as clean as you can have them as a private toilet. And so the communities are ready and they are able to share these facilities. They are accessible to everybody at all times, and they know how to handle it, even though the numbers are huge on them. And so as you can see, we are able to make separate toilets for men and women. We take care of menstrual hygiene issues as well, a portion of it. And then we also make it accessible to people with disability. So running water system, and then we also try to manage the waste. So septic shared sanitation is not necessarily an unclean sanitation. If it comes to cleanness, I tell you that if any of you visit these toilets, you might want to sit there and read your newspaper. So this is how the situation looks like before, and then you can see on the right. And then if you also look at what is over there, it's just telling you pictures of what we have done on the ground. If you go to the normal slum area, people are having wells very close to their houses. So if we allow shared sanitation not to be in the communities, then it means that indirectly we're just getting direct pollution into the wells. And so shared sanitation is actually something that is unavoidable. So these pictures are just showing you how clean the environment is. And so there's no need to talk about uncleanliness if the people in that area are even able to manage their own sanitation to look like this. And so I think there will be more discussion on this. I would want to thank all of you and ask us to all come together and talk about this topic and see how we can help the 1 billion people who are living without access to sanitation, because SDG 6.2 cannot be achieved if these 1 billion people are left out. Thank you.
I want to welcome you back from Bangladesh. Why don't we take a trip to Kenya, and we shall have someone tell us about what's happening in Kenya.
Are you also from Kenya?
Yes, hello, it's me. I'm from Kenya. My name is Ruthie, and I work with Sanergy, and Fresh Life. And in a moment, I'm going to flip the slides and tell you a little bit about our service. But what I would like to do, perhaps I will give you a teaser. I want to just sort of recap a couple of points and tell you what I'm hoping to convince you of with my next few minutes. So what I think we've heard, and just to recap, is that right now, there are lots of people living in informal settlements, and that in those informal settlements, it's not feasible to deliver household sanitation where they are right now, right? So like we may have visions for the future. I hope we all do. I have lots of beautiful visions of the world we can live in. And in this world right now, sanitation solutions that we can deploy where people are really needed. My biggest challenge as a provider of safely managed shared sanitation services is that there's no way to differentiate between good shared sanitation and shitty shared sanitation. And so my hope is to show you that it is possible to deliver dignified and safely managed sanitation through shared facilities. And what I think you will, I guess a secondary goal is to give you an idea of the kinds of guidelines and standards that could differentiate between good and bad shared sanitation, and also to increase the availability of safely managed, dignified shared sanitation. You're welcome to listen to what I say, and the take-home message is it's the service, 1. 2, our products enable a good service. And then 3, our franchise model enables us to conduct quality assurance as we go on. So happy to show you some pictures and tell you some more things, but those are really the things that I hope you take away. So I'm gonna skip this one and skip this one and even skip this one. Jumping to the product that we have. The main product that we use is a Fresh Life toilet. This is a private shared toilet operated by franchisees. So we have local operators who are responsible for maintaining the facilities. And what you can see here is that we use a container-based model. So we've got kind of a zoom in on what sits below the surface. Source separating, and essentially what we do is we go out every day or every couple of days, and we swap out the empty container or the full containers for empty ones. So if you think of how Coca-Cola can get full bottles of Coca-Cola to the ends of the earth and swap them out for the empties, we just do the opposite. Slightly less exciting contents. And we consolidate those in the periphery of the informal settlements, where we're able to also come in with trucks that then take the waste out of the community to a central treatment facility. As a side note, we also operate consolidation centers for manually emptied pit latrine waste. And I think what we in this session can take from that is that we are not letting the perfect be the enemy of the good. We have a fully managed value chain solution that is our container-based toilets. And we know that if we just waited for everyone to adopt Fresh Life toilets, we would move slowly. And we know that there are tons of waste from unsafely constructed and managed pit latrines that are dumped directly into rivers. And so if we can take a lesson from working with manual emptiers, this don't let the perfect be the enemy of the good. After lots of years of hard work to develop our model, we are partnering with, in one of these photos you can see Kiwasco, the Kisumu Water and Sanitation Company, and we've also been able to launch operations in partnership with NWSC, the utility in Eldoret. And we produce insect-based animal feed and organic fertilizer, as well as some biomass fuel briquettes that we use to power our own operations. I'm kind of speeding through this because it's not really about the model, but I am happy to tell you more about that. And a bit about our impact. So over the last 12 years, we've built our network to over 7,000 toilets, serving 280,000 people. These are people who are living in urban informal settlements in the kinds of households that you've been hearing about. And we are these are some numbers, but basically I think that the key one is 17,000 tons per year of sanitation waste that is managed safely that otherwise wouldn't. And so again, as a recovering perfectionist, I will emphasize my new mantra of don't let the perfect be the enemy of the good. I'm not arguing that this is perfect. I'm not arguing that shared sanitation services are all that people should ever be able to have, and just that this is a way to make a difference in the meantime, and that it is possible to manage it well. And yeah, that we have over 6,000 operators. So these are local entrepreneurs who act as franchisees. And we've built a team of over 400 people. While I am not Kenyan, I assure you that the vast majority of our team is. And most of the people running these operations are Kenyan and largely from the communities that we serve. And I will just end with our invitation to join us. So happy to share more in the panel about how it is that we do this, and just to emphasize again, not arguing that this is exactly what everyone should do, just showing that it's possible to manage this in a way that delivers safe, dignified services to people where they are now. Thanks so much.
Think, that's really well-delivered presentation. Thank you so much. I know you have so many questions, and I can see them burning, but I could promise you we're going to have over 30 minutes to attend to all those questions. But what I want us to do now is we've heard from Bangladesh, from Uganda, from Kenya, and that's the real-life kind of examples. We had UNC spend some time looking around all published literature, trying to clean up, look at all that and say, okay, what exactly is about this shared sanitation? Why is it not working? What do we need to do to take care of these people in these informal settlements? How can we start to let people know that this is important? We want them to come and share with us, what did they find?
Hello. My name is Sarah, and I am a PhD student here at UNC. I am in the Department of Environmental Sciences and Engineering. And my job here today is really to convince you to consolidate what all the speakers before me have said. So just key highlights from what the speakers before me said. A lot of urban residents live in informal settlements, and they highly rely on shared sanitation. The other key insight is that in these settlements, having individual household toilets is almost impractical. So shared sanitation is what we are debating could be an option for them now as we think of incrementally offering individual household sanitation. So my job now is to take all the evidence that has been presented from Uganda, from Bangladesh, and from Kenya, and to draw parallels with all the other evidence that's available globally to see whether there are similarities. So again, just to situate you with some background, the recent JMP report showed that over 570 million people rely on shared sanitation, and that was an estimate from the year of 2022. But the provision of these individual sanitation facilities, like we say, is almost unfeasible for informal settlements. The JMP currently classifies shared sanitation as limited sanitation. What that means is that there's households that are sharing sanitation with other households. So it has not yet gotten to the standard of basic sanitation, leave alone safely managed sanitation. So if it's going to be challenging to deliver individual toilets, why don't we think about how effectively we could deliver shared sanitation in these settlements? So we ask, in what ways do informal settlements and the characteristics of those settlements shape the way different sanitation services are being managed and delivered? So my study, I do not come from Kenya or Uganda or Bangladesh, but we did run a global systematic review looking at over 248 studies a combination of peer-reviewed articles, but also great literature. And all together, we synthesize this evidence to show what's happening around different informal settlements all over the world. Just a point to note is that our definition of shared sanitation within this side event today does not include institutions. So we are not thinking about schools, we are not thinking about refugee camps, we are also not thinking about markets. So just basically household sanitation. So thinking back to the UN definition of a slum, which is also another word for informal settlements. A lot of speakers before me have mentioned an issue of land tenure. A lot of residents within those informal settlements are squatters on those parcels of land. So having to make a large investment on a sanitation infrastructure is almost impractical for them. Also, there was mention that a lot of them are low-income earners, so thinking about a lot of capital expenses, leave alone operational expenses that are associated with sanitation would be a bit unaffordable. The other issue is on just residential status. These communities are highly dynamic. People move in and out, trying to find greener pastures. So investing in something that's really expensive for when you don't know how long you'll be living on those settlements is one driver for just not having toilets, really. The other aspect is thinking about just the population density within these settlements. You've seen really good pictures that are depicting what these settlements look like. So just having enough footprint to put up a proper toilet for each single household becomes an issue. The other thing I would also like to point to is on the issue of water. Sanitation and water are so highly intertwined, and to have a settlement where there is no consistent supply of water makes it really difficult to operate toilets. That might be very different for Fresh Life toilets in Nairobi. Those are container-based, so require really little water, but it really is an important factor to think about. So all of these factors collectively really drive why the sanitation services within informal settlements are shared amongst a lot of households and not really individual. The other question that I would like to answer today is, are these shared facilities worth investing in? Should we be spending a lot of airtime today talking about this anyway? Should we be incentivizing funders to prioritize these settlements? There's a whole lot of studies. I know you've probably heard a whole lot around, and you're probably also thinking it right now. Are shared sanitations do those facilities perform better in comparison to household toilets? Think about different health outcomes, environmental outcomes that we do look at when we are implementing sanitation interventions. So there's a lot of mixed evidence out there, but what I would particularly like to highlight that's important for this discussion is that there's been studies that are comparing what it will look like when people who use shared sanitation, what their health outcomes will be vis-a-vis those who have individual toilets. So outcomes such as diarrhea, outcomes such as transmission of soil helminth infections, all of those outcomes can in fact be comparable between shared sanitation users and those who use individual toilets. I will make a plug for a more detailed discussion on the findings of this review, but I really wanted to highlight that a lot of these studies also do not compare shared sanitation with no facility at all. How does somebody with no facility compare to someone who is using a shared sanitation, and eventually comparing to someone with an individual toilet? So thinking about the entire continuum and how that compares is important for this conversation. The other thing I would like to talk about finally is, can we also effectively evaluate the quality of these services? Are all shared sanitation facilities same in quality? Should we, go for them despite the different ranges in quality? So to have a really successful shared sanitation program, out of this review, we are saying that, number one, there should be a really good system for cleanliness, and that could look like cleaning schedules across all tenants within the plot. That could be a hired caretaker who's paid to clean. So cleanliness would be paramount, especially when you think about fighting infections. The other thing that's really important around effective shared sanitation is how many users would share a toilet. So again, highly recommended that the number is kept low. A good recommendation from the literature will be to keep it at a number of 5 households or 30 people, whichever of those is fewer. We also do recommend a lot of considerations around privacy, so that will look into the design of your system. And is your door lockable? Is it functional? Can someone lock it from the inside? Are there cracks? Are there holes? Can people see? This issue is particularly important for women and children who've reported a lot of cases of sexual assault, violence, particularly related to using a shared sanitation facility. The other things that we'll also like to highlight that I think the other presenters alluded to are issues of accessibility. Could people with disability use these systems? Things like that. So because this was supposed to be a high-level summary, I would like to conclude that the need for shared sanitation is still there. It's possibly going to increase. And therefore, if you've picked at all one thing out of this presentation today, I hope you're fairly convinced that we do need shared sanitation in these places and that they are better than no facility at all. And we could incrementally start to invest, continue to invest in shared sanitation as we hope to move to more safely managed sanitation services. And as I leave, this was a rushed report of a systematic review, but I'm putting in a plug for a verbal presentation that Lauren here will be making. So she'll be looking more into going into details around our systematic review, our findings, but really importantly and very exciting is we are making recommendations about different indicators for evaluating shared sanitation. So her presentation is happening right after this session, and it will be in Dogwood. Thank you all.
So thank you so much for that presentation, and thank you so much all the presenters. This is not a verbal session, this is a side event. So we're stopping presentations now. What we need to do now is to get all these presenters, because I don't want you to send all the questions to me. I want them here, so they can answer all your questions. We also have others online, so we've got Yvonne Lugala, who would be online, and she's really very much, been involved in all these kind of aspects, and she needs to really contribute to this conversation. We also have Barbara Mary online from KCCA. So why don't we have our, presenters forward, and then we could have this kind of, I also have questions for you. So hopefully I should be able to put them forward. So what we've done in this this side event, we wanted none to be talking without evidence. We wanted people who are working in these communities to come and talk to us exactly what are they doing to improve access and what should we do. We are researchers, we are practitioners, we are people in this field, and we really not listening on the ground to know exactly what works and what doesn't work, and what should we do to make sure we can help, help these members. So on the panel, you have 5 people, and I think the way to be, we'll have people, come forward, ask your question, and you can actually shoot it to the person you want to say, hey, I want this question to go to this person who said this, and I want to know more about this. So as they come, I have my own questions that as they were presenting, I was trying to really write down. I'm like, oh, really? Why are you telling us about this now? And what don't we know already about shared sanitation? And why do we have these issues here? But if you have your question, you're free to let me know. So I have the first question, and this goes to John. One of the things John talked about from Bangladesh, he talked about how they are maintaining this to be clean, and even for us to read newspapers from their toilets. And that was, to me, is like, oh, okay, I would probably try that out. But I have a question, which is, you're talking about this, but operation and maintenance of shared sanitation facilities could be challenging in slums, and it's really challenging in some of these communities. Therefore, if we have these challenges, why should we still invest in this? Why do you think we should invest in this, really? because it's really complex. Like I've seen shared sanitation facilities in these communities. You don't want to go in there. So if you're doing this, why do you think we should be investing more in here?
Okay. I thought you were not going to ask me a difficult question. Anyway, yeah, as I mentioned, we have 1 billion people living in informal settlements, and we have no land to give everybody an individual toilet that would be easy for them to maintain. And so they have to make do with something. And it will interest you to know that the UN Human Rights to Water estimates that those living in informal settlements end up paying 5 to 10 times higher costs for services of wash compared to those who have the access. So we all say they are not having enough money, yet they are the people paying higher. So that is a big issue. So for us to actually look at it from another point, informal settlements, if we don't support them, they are definitely going to be the conduit for public health concerns. I can tell you that it will take only one person in that informal settlement maybe to infect the whole country with maybe cholera or maybe typhoid or something else. So we have to really look at that. But in order to address the cleanliness, it is very important to know that operation and maintenance is a challenge across the wash sector. Even water that we provide services, about 40% of those services are not working. So operation and maintenance challenges in the informal settlement should not be anything that should stop us from moving forward. Secondly, if you also look at them, there are people who actually need the services. So when you, at the program level, if you are able to explain and facilitate and bring them together to be partners and not beneficiaries, if you make them your partners, you are definitely going to get a buy-in into the operation and maintenance. And I just wanted to show you something. I have an ATM card here. It is not an ATM card for money. It is poop ATM card. So if you have operation and maintenance issue and you are able to use this for people to access the door, it's very easy for them to be able to maintain the services there because nobody is going to make it dirty and go. They will all know who has gone there and done that. So we need to be innovative, we need to be creative, and make sure we solve this problem. Otherwise, operation and maintenance is a big challenge everywhere, and we should not shy away because it's very difficult to manage shared sanitation. Thank you.
Thank you so much for your question. We've got a question from the audience. Yes.
Can you, yeah. So hello, thank you for the amazing presentation to the panel. I think I also have a question for John, but I think everyone from the panel can also answer this. Thinking in terms of shared sanitation, I think the major issue that the panel also sort of spoke about, which was interesting for me, was connecting sanitation with land tenure, which is a conversation that has sort of not emerged in other panels that I have attended so far. And when I think about land tenure, I think the biggest issue sort of comes in is like, it's often viewed as a process of legalizing these informal settlements in terms of like provision of these services. So if you could like speak to it in terms of like, how are you in your own work trying to like bridge this very issue of like service provision while also maintaining the issue of and working with the issue of land tenure would be nice. And my second question is that often in terms of like shared sanitation also, the toilet seat ratio is again a major issue that sort of really comes in, is where like 100 people having access to just one toilet seat. While it may be hygienic for several reasons, but we can agree to that the toilet seat ratio is definitely like not a hygienic way of sort of using the toilets. So, I mean, how are we sort of also like thinking about maintaining those issues while also providing access to like safe sanitation? So, yeah, thank you.
Great question. I think anyone can take it up.
I would just give a little initial response to the sort of how we deal with land tenure. And so something that we learned, actually, someone here was very involved in the early days of this. So she may choose to also speak to this. But basically understanding both the formal and the informal elements of land tenure. Obviously, no one has formal right to the land in these contexts, but there are very, very complicated structures that exist in terms of who has informal right to build on the land, to collect rent for the land, and after some mistakes early on where we didn't properly understand that and we would build a toilet and come the next morning to find it had been demolished, we built into our sales and vetting process what we like our government review. And our government relations team includes formal and informal government relations, and basically just making sure that before we start building, we are in touch with the chief and the chairman in the community, as well as anyone else they tell us to talk to, who can speak to, basically make sure that the person who's signing up to open this toilet has, again, any informal like approvals that they need in order to operate there. And so it doesn't mean that we've solved the big problem of land tenure, but it does mean that we sort of protect our investment in a facility there, which was a big challenge early on.
Yeah, that's a great response. Yes.
Yeah. I can also just add one word. Yes, of course, the issue of land tenure in these informal settlements, I think it's a global discussion that has been going on, I think, in all what is called old slum upgrading projects. You know, the discussions from governments before you know, the 20, 30 years ago was, you know, those areas are not legalized, they're not formal in the city, so we neglect them. And said, and they have no right to be there. Then we tried the unsuccessful attempts by some governments to come and actually clear these areas and move people to other areas. In 1 year, 2 years, they were back into those same areas that we were moving them. I think consequently now we've come to understand that yes, these areas are not legalized, they don't have land titles, but they are there, and they are reality, and they are part of the city, and you can hardly, it's very more difficult to leave, take them out, to bring them into other areas. So the general trend now is to keep them there, but provide services in a manner that can be legalized. The same old, for example, we take example in the water situation in the old days in Uganda, we used to have, well, if you don't have a land title, which you take to the authorities so that they can be able to put a meter against a land title owner, we cannot give you services. So these areas were left out, but now we have discarded all those formal legality. You say, well, just give us a tenancy agreement or whatever, show that, or your identity card, anything that you can legalize based on to know that you are so-and-so who lives and how we can get to you. Your phone number is also even almost enough. A registered phone number is enough to show your residence. As I said, a chairman or local person can sign for you, and so this person lives here and is known. And that's you are entitled to receive a basic service, and you can be able to be supported. As I mentioned, of course, I agree with you there. You know, the discussion, for example, a question about the technical options that are favorable or not favorable. So in the same scenario, the same sitting, even in schools, we have this discussion of the people to stance ratio, how many people can use this kind of facility. We know that sitting toilets, for example, are also not very well used in schools where people in numbers are many. So similarly, when you come to these such informal settlements, then you look at different technological options that are suitable for this kind of shared use, where we tend to prefer, for example, the squatting toilets, squatting pans type. So in terms of, we shouldn't close our minds to the different options. We know that these are challenges, so it's difficult to clean a sitting toilet which is being used by 30 people and so plus. Therefore, you provide a technical solution that is adequate for that kind of usage, rather than a one comfortable one in your living room. Thank you.
Yeah, and just to add to that, we are a housing organization, and so land tenure is actually a big part of us, because we can't build a house without addressing land tenure issues. But what happens in the informal settlement, like my colleague is just explaining, the people don't own the land, they are squatting. They don't know when they are going to be ejected. But disease does not require visa to travel from informal settlement to the formal settlement, even to the presidency. So, because of that, the government understands the need. So, our team members work closely with the government to address the issue, because you don't want to use only 3 people or maybe 3% of the people to cause a problem for the 97% of the people. So we're able to address that. The second thing about the number of people using it, I can tell you that although institutional latrines are not, toilets are not considered, but if you enter here, you realize that the toilets are as clean as any other private house that you probably will have your own toilet. Why? Because there's constant cleaning, there's constant maintenance. And somebody goes there and knows that my next neighbor is coming. If you enter the plane, it's the same situation. If you go there and mess it up for the next person, then you are really inconsiderate. So we need to incorporate all this into the original programming and let everybody know that you don't have option. Can you be each other's keeper? Can you be each other's colleague in using the toilet? And I was very surprised when I opened one of the toilets. I was in Bangladesh in, I think, February. I opened the toilet and asked the people, how many times do you clean this toilet? And they said, we have a schedule, and this toilet is clean like a bedroom. And I actually comfortably went to look at the toilet. I felt like sitting there and relaxing because it's tiled, it's well tiled, the seat is very comfortable. So the way we design the toilets and what we put in the toilet also makes it, the operation and maintenance much easier. So that's just what I wanted to add. Thank you.
I would like to chime in a little bit more around the question on users, the ratio. So there's a whole lot of nuances around the ratio of users versus number of toilets. Think about in different contexts, there's different household sizes. So how large a household is, you could say, if you let every individual household have its own toilet, and one household has 3 people and the other one has 16, there's differences. It could also be, are the people using this toilet related? Are they members of an extended family? Are they, tenants who have the same landlord who lives there? So is there some commonality? Sharing number of people in itself doesn't really mean anything, but it is how organized the group would be to clean the toilet, to maintain it, to operate it. So just starting to think around, if there's a lot of people, how do we have a common point, perhaps a focal person, perhaps a caretaker, who can organize them around cleaning and maintaining this toilet? I hope that is helpful. Thank you.
Thank you. Yes, can we have another question?
Yeah, thank you very much for all of your presentations. The questions that came to my mind is that, for you as environmental engineers or persons taking care of the communities, will be that in your conceptualization of all of these ideas, were there prior consideration in terms of data collection, noting what the real needs of the people are, the population to serve? Because these are all very important as a precaution, before even projects are being embarked upon. You'll agree with me that it comes from conceptualization to design, from design to construction, and construction to operation and maintenance. So if all of these factors had not or were not considered from the beginning, then the place of operations and maintenance becomes an issue. I heard also from your presentation that you excluded, institutions, schools, and all of that from your context. My point again would be, those people also will be channels of driving these ideas. Schools, children are there to initiate them, to let them know, sensitization, that when you get home or you get to your various shared facilities, these are the things because we did a study some time ago in Nigeria as well, looking at schools and all of that, because it's very important also to integrate even the would-be users. When they all leave school, they also come back home. Well, if they are all excluded from this, then how will that, sensitization and all of this knowledge come into play? So I think it's very important we look at all of this so that it won't be at the end of the design or at the end of the construction, we now begin to look at problems again to solve when we had not even considered that from the beginning. I think that's the point I want us to make an explanation to. Thank you.
Yeah, thank you so much. That's a great point. And questions are all to you, not to me. So.
Can I start off with the comment?
Well, I think thank you very much for that contribution. I think it was not necessary, but it was a very good concern of where to put in the considerations of the people at the start. Now, it's a very important, and I like the discussion, and I would say that's the reason we're having this discussion all together, and trying to see how we integrate some of these aspects in what message we give to the communities. Now, the sad bit of it, yes, SIPA says, yes, we do that. We do consider communities in these informal settlements, and we have discussed their needs. But the sad bit of discussion, that my experience of it all, and when we talk to these people from the start, I mean, when you go and you ask them in a informal settlement, what sanitation do you want? He wants a flush toilet. He wants a flush toilet. And so everybody, so when you talk to them, if you say anything in between is considered inferior, you said, yes, I may not like it, but the onus is on you and I, the leaders, there's different situations, to show that these are the categories available. So actually in my office, what we are doing there in the last 5 years, when we are talking about this safely mined sanitation, to show exactly what we need. So even when you go into the policy documents, the documentations, whenever we talk about sanitation in urban areas, the only solution they are mentioned is sewerage. But we have started, here we are now, the Kampala city has been in place since 1950s, 100 years later, we are at only 10% of the population has got access to sewerage services. So if we continue saying that our only aspiration is sewerage and nothing in between, then probably another 100 years we shall be at only 20%, and that's not the situation that we want. We say, so we can have something in between. That's a message we are giving the people. And if we all speak the same language, if JMP also says, well, okay, we can accept this as an intermediate solution as long as it meets this minimum requirement in terms of health, this is good enough as we aspire more to reach the sewerage that we desire in the future.
Speaking of aspirations, aspirational needs around sanitation, so there's evidence out there on studies that went to the communities and asked questions around what would make you want to use a shared sanitation facility, keep you using it. And they said things like, if I have access to a toilet 24/7, 24 hours a day, if it's well lit, I can go to it at night and feel safe. If it's not too far away and just within my compound where I can safely walk there, I will feel safer. If there's a lockable door, if there are no cracks, if there are no holes, if it's clean. So there's actual studies that have measured a lot of user experiences, priorities and preferences, and we could possibly address those because they're more low-hanging fruit as we eventually look into more aspirational needs of the communities.
I want to appreciate the interest in data and sort of de-risking and understanding as much as we can before we start, and also emphasize a mantra. I'm really into these mantras, but it's JFDI, which stands for just do it. And if we have time, I think Sarah, I'm outing Sarah as a former member of the Fresh Life team, but I think I would say that the data that we want to incorporate, or the insights that we want to incorporate into our design, probably fall into two buckets. One is things we really already know, like if it's not managed well, it's gross, and land tenure is complicated, or things that we can't actually know unless we start operating some kind of service, like do people actually like the design of this seat, or are the land tenure dynamics the same in Mabatini as they were in Kwaruben? Spoiler, they weren't, and Sarah figured it out. But really just sort of the idea that we did some great research as Fresh Life in 2010, 2012. And if we continued to use the learnings from our initial work, we would have done horribly. And ultimately what we do is we have some things that work, and then every time we go into a new place, we're curious and we're humble, and we let people tell us what they hate about the thing that we love, that we worked really hard on, that worked next door, and then we change it. And I think that's sort of like, yes to learning as much as you can before starting and at the conceptual phase, and also it's complicated, and as long as you keep learning, it doesn't really matter if you get it right from the start.
Good, good. Thank you so much. I think we can have another question from you, and then yes.
My name is David Cheche. I'm the Global Head for Water Supply and Catholic Relief Services. Thanks so much for this presentation. I'm just wondering where all these useful research and findings are actually going to land. Because you talk about close to, or even being conservative, 500 million people living in slums, and I guess it's even more than that if we want to consider migration and other places like the IDP camps. So my colleague, my former colleague, Rick, I look at you and see how is this research work or findings going to feed into the JMP? Because you reference the JMP saying that it is limited, which I know of, but then this is the reality, and it's not going to get better in terms of slums, it's going to get worse. And I think the whole idea of this workshop is how does research feed into operational areas. So I just wanted to throw this out and see how best the JMP colleagues and others can sort of really look at this.
Thank you so much for asking that. Super important.
Yeah.
So this is my take. I think that we are, I may not be the authority for this, but I think that we are grossly undercounting how many people are using shared sanitation in the first place. I think that it might be really helpful for the communities that rely on shared sanitation if we continue to invest in them, but particularly if we continue to invest in high-quality shared sanitation, not just any sort of shared facility. To do that, we need to define what a high-quality shared sanitation is. So what we are proposing from our body of work is these are all the indicators that come from preferences of users, that come from, evaluations around just impacts on health, impacts on environment. This is what we define as a high-quality shared sanitation. And it's things I've talked about: accessibility, privacy, safety, all of those things. So I would hope eventually that the JMP listens to this and starts to reconsider how they are categorizing shared sanitation, so that not all shared sanitation facilities are clumped as just limited. That would be my take.
Thank you so much for that response, and I think Rick is coming close to the microphone. I know we have another kind of presentation coming up, like I think 3:30, and someone's going to talk more about the classifications, and I think Rick is there to probably try to respond to some of the worries raised.
No, thanks so much. And actually, the last comments that you make resonate completely with me. I am really pleased to see so much work being done in different countries to define what quality shared sanitation means. And I think we can all recognize that there can be quality shared sanitation. There can also be really bad shared sanitation. And it's important to have, specific definitions, metrics, indicators, monitoring systems to distinguish, what is a quality shared sanitation system from one that is not. And that might be different in different countries. There's not a global definition, but there will always be the need for public toilets. Even when, in the distant future, everyone has an individual household toilet, we still go out and spend a lot of time outside. We need access to quality public toilets. But in the short term, there will also be people who cannot have individual household toilets as an interim solution, and there will be a need for quality community toilets. So I'm glad also to hear that considerations of quality include not only cleanliness and health, but also dignity, security, privacy, accessibility at all hours, even for the elderly, for the women, for the vulnerable. Those all need to feed into national standards for what counts as quality sanitation. I want to clarify also that there are different types of global resources and frameworks around sanitation, including shared sanitation. So we have the JMP SDG monitoring framework, where sanitation that is shared, improved sanitation that's shared, is classed as a limited service. I think we can agree that having shared sanitation, even if it's quality sanitation, is not as good as having quality private sanitation. It is a lower service level. That doesn't mean that it can't be good, but it is still not as good as having a private sanitation facility at the home. And I think we can think about the ambition of the SDGs, and if the ambition of the SDGs is such that in some areas they cannot be met by 2030, that doesn't mean you throw out the ambition of the SDGs. In fact, the SDG framing specifically says that the global targets are aspirational, and every country is expected to set their own national targets that reflect national circumstances. So it might be the case that a country says, we can't get to 100% safely managed sanitation by 2030, but we're going to get to 50%. That's one thing. National targets don't have to be 100%. The second thing is that the small set of global indicators cannot reflect all the diverse needs in different countries and have to be necessarily simplified. But that same SDG framework calls on countries to set their own national indicators and regional indicators that go beyond the SDG framework. And I think shared sanitation, quality shared sanitation, is an excellent example of where countries should step up and say, this is a gap in the global framework. We know what should count for our national situation. We're defining these indicators. We're going to measure them. We're going to report on them. That is the way the SDGs are supposed to work. Now, the global SDG framework is one global process. We also have more normative work, which is not always amenable to global monitoring. We have the guidelines for sanitation and health, which specifically recognize that quality shared sanitation is an important and interim solution, and that as an interim measure, it has to be available to fill a need. So I think, what can the JMP do to reflect these? Well, we're not going to change the global definitions halfway through the SDGs and say that quality shared sanitation counts for safely managed. But what we can do is highlight good examples of national indicators saying, what is or is not quality. Here are the data that show, maybe, hopefully, an improvement in the population that is using quality shared sanitation. And, highlight that as a good example that other countries can take inspiration from, because it's all around the world. In dense urban settings, many countries are facing these same problems, that there has to be quality shared sanitation as an interim solution, but we don't know what it looks like. So if you guys have good examples, good indicators, we can highlight them and spread the news around the world through our platform. Thanks.
Thank you so much for that, Rick. I think we have some people online who actually were supposed to be on the panel, but they couldn't travel here. And one of the questions I think that I needed to throw to them, based on the presentation made by Dr. Swaib Semiaga, was to understand the role of government plays in shared sanitation. Because one of the things that is coming up over and over is, how do we manage them? How do we keep them quality? How do we make sure we can keep them running? And that's the question I would love to throw to one of the government officials, I think that's from KCCA, to tell us more on what's the role that the government play in ensuring people have access to quality shared sanitation services in these communities. And I think that could go to Mary. Can you hear me?
Yes, we can, Dr. Musa. Thank you very much. My name is Barbara Aine Mary. I work with KCCA, and I will touch on a question that you have just asked. The government is already doing this role. We have a number of policies and acts that are in place. We have the KCCA Act that mandates KCCA to provide public sanitation and safe sanitation for all. Then we also have the Public Health Act that ensures and is specific that each building should have a sanitation facility, a latrine or a toilet for households in particular. Then as KCCA, we have also empowered the private sector through different programs. We have we provide an enabling environment. We have capacity building programs in place. We have some initiatives in place that basically support these private entities to provide sanitation services through training, through business development programs that basically build their capacity to provide these services to the people. And we also ensure that we market these services to put it out there so that the communities and the households are aware that we actually do have these services running within the city. So that is how, those are some of the ways that the government is ensuring that sanitation is a priority. Thank you.
Thank you so much, Mary, for that. So I think along those lines, would love to hear from Water for People to tell us, because all those require resources, require putting money in making sure these things are sustainable in these informal settlements to ensure quality shared sanitation. And I would love to know, like, why should subsidies remain? Because one of the things that Dr. Swaib mentioned in your presentation was subsidies. And I want to know more how, why would subsidies remain in place even for scaling up these shared sanitation efforts in those informal settlements that you're working in? And this should go to Yvonne.
Okay, great. Thank you very much, Dr. Musa. I hope you can all hear me well. My name is Yvonne Lugali. I work with Water for People as the WASH Sustainability Manager, and really just sharing upon the experiences. And I know when the previous speaker was right before Barbara, I was nodding my head in disagreement, then agreeing with him at some point, then, I was really going through a range of emotions. But one thing I think that's very important and key, even as we're talking about access to sanitation, is the importance of ensuring that there's inclusivity for everybody. Everybody does have a right to have access to what all of us are qualifying as quality sanitation facilities. And even people in informal settlements, even with all the challenges that we know about informal settlements, and this is really where the space for the subsidies and incentives come in to level the ground and ensure that everybody has access. Just like Barbara was talking about some of the interventions, of course, working with the city. So in Kampala, there are minimum standards. In other words, your toilet has to meet the minimum standards. And to ensure that quality, some of those toilets are maybe not as affordable as would want them to have, to ensure that we actually meet those standards within the city. And so from my experience, as we've been implementing the Citywide Inclusive Sanitation Program in Kampala, and particularly the focus on increasing access to sanitation facilities in these informal settlements, we did what we call incentive models. So, you're incentivizing the community activation teams to be able to encourage landlords to construct these toilets, but you're also subsidizing some of the costs. So particularly for the minimum standards, what's very key is the substructure to ensure that you actually don't have any leakage of sludge into the environment. And so that's where the subsidy went to. So if I go to a household, and again, we would use the human-centered design. Engineer Felix was talking about, people might not necessarily be able to get the sewerage services, but they should be able to get something that they like, a toilet that they can pay for, one that they can be comfortable in. So we do human-centered designs where the household is able to choose how the toilet should look like in terms of the superstructure. And then when it gets to the substructure, that's where the subsidy has been provided to lower that cost and ensure that this landlord is actually able to pay. I think it's also important to note that while we're implementing this, the focus has been on the landlords. So you have to be able to own that land. You have to be able to show proof that you are the owner. And then, of course, we've been targeting those landlords that have tenants, because the truth is, in informal settlements, you're not going to get people constructing private toilets for each person or for each household. And we've been having a discussion here with Barbara and saying, if a household has 10 members and you have a landlord having tenants with 5, let's say 5 tenants, are you saying that the tenants who are sharing a toilet block have a lower level of sanitation than a one household that has one toilet block and has 10 people using it? And so that's some of the discussions we have to think through, even as we're making these indicators at a national level, at a global level, and what actually works. Yeah, thank you very much.
Thank you so much. I think I want to close this session, but as I'll tell you, this is a very exciting topic. I know Barbara Evans has been nodding her head there every time this has been going on. But this is an exciting topic that we can't address in one day. And we'll keep thinking about this, and therefore what we've sorted of is to have a working group. We could get thoughts, like we've had from Rick, we've got from different people saying, let's think about this. And this is something that we should be thinking more on how do we move this forward. So you could sign up for that, so you can be part of the working group. We call it ASSIST. It's basically, joint, we try to advocate for shared, quality shared sanitation services in these informal settlements. And that's something we should keep pushing forward. We don't want these voices to go down, because once we keep quiet, then we're leaving these people behind in these communities. We're really not thinking about them. As we keep this forward, we're actually advocating for the quiet shared sanitation in these communities and making sure we're having these people public health protected. I would say big clap to the panelists. I know we have 1 minute to close it. Thank you so much all for coming, all where you've come from Bangladesh, from Kenya, to come and share these experiences. Thank you so much. And thank you so much, the audience, for being here to discuss this important topic, and let's move it forward. Thank you. Oh, the code doesn't work. The technical person is going to fix that. She might make sure the code works. All right, thank you so much, everyone.
Thank you so much.